just to reiterate, there is nothing that would prevent a local school district from choosing to continue to do that. This just eliminates the requirement. They could continue to choose. And I guess that's the point of the whole bill that I want to speak to again. We should be empowering local school boards, who we all say are doing what's in the best interest of kids, to choose the best route for them to do what's in the best interest of the kids that they serve. Nothing in this bill prohibits any of the things that are being said. The hiring of nurses, the working with the organizations for those screenings, nothing prevents them from doing it. It allows them to make that decision.
Sure, I just noticed that, in line 15 on page 4, it says they shall send those to, I think, to the department. So that's kind of where we just want to
certainly, and that would be true, but a school district could also work with you to make sure that information came to them as well.
Mary Brown with the Board of Regents. We are undecided on the bill. I have two folks that came down from UNI this morning that would like to talk about Section 13 dealing with teacher librarians.
Sure.
I'm Carla Krieger, faculty member at the University of Northern Iowa. I'm preparing teacher librarians. I'm also a parent of students, and I am here to ask for striking Section 13 in the bill because I'm talking about the importance of what teacher librarians bring to students and the benefits they provide in all students, not just those that may have that option, but all students, and school boards need that support to be able to know that this is important and established. So we're not talking about what may be seen as a stereotypical role of a teacher librarian. We're talking about they're wearing at least 3 hats in what they're doing in the building. They are a direct instructor for students. They are teaching students important skills, makes them better readers, also makes them better writers and researchers. In addition to that, they are also leading teachers and helping make teachers better teachers because they're able to provide the resources that teachers need in all content areas and grade levels to connect with their students and managing variances of resources for different ability levels. All of the third hat is the administrative role. All of this cannot happen with the person who's the glue that's holding all this together. The resources don't magically appear that meet the needs of the students in the district, that have the highest quality resources, that provide rigor, and those only happen because a person is specifically focused on having what is best needed for their district.
Hi, I'm Joan Taylor. I'm also an associate professor of school library studies at UNI, a former classroom teacher, and a parent of 3 kids that I trust to Iowa educations. I'm asking that you strike Section 13 because just as first grade teachers, high school science and math teachers would never be seen as optional in a school district, neither should the teacher who has contact with every student and every teacher and support staff person in the building to provide them the resources they need, especially in the information age where digital context are proliferating. It is the teacher librarian that teaches across the literacies to make sense of all the information and their digital footprint and all of the things that every kid in this state deserves to know how to do and to do well. Thank you.
Brian Stearns, professional educator of Iowa, registered as neutral. Thank you for allowing us to be here. It's interesting to listen to the comments, and I find myself agreeing with many of them. The question seems to be, do we trust our local school boards? Thank you.
Dave Stone, United Way of Central Iowa. We are registered against this bill. This is the 3rd session we faced this legislation, and last year we worked to compromise to have a student health work group over the interim. We largely believe this bill is not in the same spirit or intent of the report that came out of that work group, which said that largely this could be handled administratively. We further have concerns about all of the screenings, whether or not the departments have capacity to handle this. I believe there's 1 FTE handling vision alone on an Excel spreadsheet. And we're taking away those relationships. The school nurses are able to do this. In fact, work group members said that it's about 2 days in the year for them to do all this reporting. Further, when they have those problem kids, they have those relationships with the parents. They have the relationship with the kids and ensure that they're getting what they need. Vision alone is a huge problem when it comes to literacy. United Way sponsors a pilot program here in Des Moines, screening all the kids for vision problems. We found 300 kids in the past 2 years that need glasses that we provide. Blood lead testing, I can't even start there because by age 6, the damage is done. If they don't have the requirement of having that test, those kids are permanently damaged mentally for the rest of their lives, and we need to have that done earlier. We're taking away the stick, if you will, to make sure that these things are done. We need schools to be partners on this data collection and getting this information done. Simple as that. We just feel like this goes against the intent of that student health worker. Thank you.
Julie Smith, I'm representing the Iowa Dental Association. We're registered undecided on the bill. Of course, we have concerns with sections 2 to 4. Thank you for leaving the requirement for dental screening in the bill, but just not having it go through the schools. I think our concern is the same as the hygienist. What happens then? And maybe that's something we need to talk about with the Department of Public Health. So, thank you.
Jan Cyber, Department of Education, we're registered neutral on the bill. I think with the amount of people that we have in here, there's probably not a point that I can make that somebody else could make a little bit better here.
Terry Gladfeller, Deputy Director of the Professional Educators of Iowa. Again, we've registered neutral for the bill. One perception we have is we're seeing more and more classroom teachers are being held responsible for administration of medications, diabetes types of things, and teachers are getting a little nervous about the liability issues that occur there without a licensed health professional in the district.
Is there anybody here that needs to speak additionally with?
So Sharon Guthrie, I'm the Executive Director for School Nurses in Iowa. And human nature tells you that if you say you don't have to do something, people probably won't do it. And historically, the legislation passed in 2007 to require every school district to have a school nurse. And it took 2 years to get that fully implemented. But in 2007, 26% of our school districts don't have a nurse. So therefore, you leave all these children without having the access to the resource of a healthcare provider. School nurses do a lot more than just collecting the screening immunizations, as many of the legislators heard of, because I was copied on a lot of those emails. The coordination of care, the daily care of youth with chronic conditions, and helping keep parents informed so parents can stay at work. We know of stories where parents won't go to work if there's not a nurse in that building. And that the episodic care of illness, and most importantly, I think when we look at what we're doing across the state in terms of mental health, the school nurse is a first-line person of mental health when kids repeatedly come in and have what we call somatic complaints, which are, I got a stomach ache, but you start to see the pattern of maybe they didn't get any food, or maybe parents are fighting at home at night. And by keeping all the data within the schools, it is the only single source of health data about youth in Iowa if you go through the school system, because there's no other one place where all that data is coming together, which is going to help us to make healthier youth overall. So I ask that you not go forward with the bill.
Sorry. Mary Nell Treves, Child and Family Policy Center. We are registered against this bill. We have several concerns with this bill. To echo Dave's statements, we feel like this legislation is premature. The work group that was formed from legislative direction last session, their report only came out in December 27th. So there hasn't been a chance to implement the recommendations that a great group came together to put forward. So we think this is a little bit premature. We also have significant concerns about eliminating the requirement for screening. Appreciate your comments, Senator, about it simply eliminating the requirements. We want to empower school districts to do what they think is best for students. But I think this is also an important equity issue. We want to have some standardization across the entire state because schools are such a critical partner. They're where our school-age children are every day. They're a critical partner to ensuring that kids are healthy and ready to learn. And so by eliminating that requirement, there might be differences in what one student in living one part of the state has access to in terms of identifying concerns early. And finally, that data collection. Screening isn't useful unless that data is going somewhere so that that child can be connected to resources. And it is an undue burden putting this on parents and as opposed to utilizing the existing infrastructure of the schools to collect and deal with this data. So significant concerns with this legislation. Thank you.
So we are down to 3 minutes, so brief.
Yes. Okay. So thank you so much for listening. You're obviously very passionate about that, and we really appreciate that. This is my daughter, Nancy. She was born with a rare blood disease. State regulations saved her life. Her school nurse is her friend. The hearing screening last week, she had identified a hearing issue. School boards want to do the right thing, but they really need state support. This bill would negatively affect Nancy's friends who attend her school in a low-resource area. They need dental and hearing and other screenings, the lead screening, and they need a safe environment, and they need state support. So please don't let this bill pass today. Thank you.
I'm Amy McCoy with the Iowa Department of Public Health. We're registered as undecided. I think the good news is that it sounds like everyone in the room agrees that screenings are really important and they help identify issues early on. especially for vulnerable populations. So that's great news. We do have some concerns about accountability with the way the proposal is put forth. And ensuring parents go and get the screenings. That's one aspect of it, is making sure parents go out and have the screening, and then also getting that information back to us, which is very valuable in the work that we do and informing the work that you do as well. So some concerns there too with, one of the things we've done is work so well with the schools to get that information back. And they really are that local resource. It means a lot more to have the local school nurse or someone call you and follow up on your child's screening versus having someone at the Department of Public Health make that follow-up call. And I just also wanted to acknowledge the work group report too. That report just came out in December. We had all gotten together at the table to work on those recommendations. So we would like to see the opportunity for those administrative burdens to be lifted and see how that does impact schools with being able to provide us with that information. Thank you.
I'm Lynn Patterson. I'm with Delta Dental of Iowa, and we registered opposed to the bill. So dental pain is one of the leading causes of chronic school absenteeism, which is why these regulations for dental screening were put into place to begin with. And I won't reiterate the concerns we have about compliance going down. That has already been discussed. But I did want to bring up that we're concerned that this approach in this bill really segments children's health. Right now, we still have immunization requirements. We even have requirements on PE in schools, and we're looking at adding mental health services. We think dental screenings are important too, because a child's dental health really affects their ability to learn. Another point I want to talk about was the dental health data collection. We've talked a lot about that in the subcommittee today, but let me give you an example of how good public health data can impact the community level. So Des Moines Public Schools looked at their dental screening data and realized that in their high school they had a large, significant increase in high schoolers presenting with emergent dental needs. So they submitted a grant to our Delta Dental of Iowa Foundation, and we granted that grant, which ended up contributing to them building the first high school dental clinic in a high school setting. And that's at Scottsville High School right now. So without good public health data, we can't approach public health problems at a community level. So when schools and public health partner together, it really does benefit children's health and their ability to learn.
Melissa Peterson with the Iowa State Education Association. We are registered in firm opposition to this bill. This was not the product of the recommendations of the work group that was created by Senate File 475 that actually had bipartisan support last year. So we thought we were going to do some good work that could give us some recommendations that would be good both for local control but most importantly for our kids' health. So that's our first and foremost concern. We are also very concerned that these are citizen boards. They are not education professionals. They are not experts, and they do need support and guidance from the Department of Education. You should not, through a roll of the dice, depending upon which of the 333 school districts you end up in, have access to a health screening or not have access to a health screen. We need to have consistent services provided to our kids, and we need to make sure that the data that is collected is consistently collected and then distributed to the appropriate agency so that we can evaluate what is best for our youngest and most vulnerable learners. I would also say we have grave concerns that last week I sat in this room and we had a very amicable, conciliatory, bipartisan agreement to support mental health coursework in our classes in what was amended yesterday in full committee to 7th through 12th grade. Who's going to provide what happens once we have identified mental health issues in our school districts if we're not requiring school nurses to be available? And required is the important part. I don't think school boards want to do things that are harmful to kids. I do think they need guidance and support. I would also suggest that we have issues with Section 12 that hasn't gotten much coverage, as well as Section 16 and 17. I don't know why we're afraid of sunshine. I think AEAs, if they're going to make budget decisions, ought to have to notify the public. I appreciate that they would still have to post it on the website. How do I know to look for it if I haven't seen other public notification? I think we need to make sure, yes, that there is a reasonable amount of local control, but we have to have appropriate guidance for our school boards, and we have to look out for our most vulnerable students whose parents might not have access to vision screenings, dental screenings, or lead testing. The fact that this bill doesn't eliminate the requirement or the ability for people to do those screenings, but doesn't even want to have to be cumbersome to the school district so they have to provide information on where kids can go to access those services, if they're not getting those services, is an extreme overreach. It should not be cumbersome to collect this data and be able to help us, our more vulnerable learners. What's cumbersome is not being able to focus on your schoolwork because you have a toothache. What's cumbersome is not knowing if you're actually not proficient in reading or if you just have a vision impairment, right? And we need to make sure that our kids have consistent access to these services as well as school nurses and school librarians consistently, regardless of the makeup of their school district. Thank you.
Charlie Wishman, Iowa Federation of Labor, AFL-CIO. I think just about everything's been said that can be said. We're in firm opposition to this bill. I agree with everything that Sister Peterson said.
Sheila Corsby with the United Methodist Church Advocacy Team. We represent all of the churches in the state of Iowa, Methodist churches. We have not registered on the bill yet, but we have a lot of concerns that have already been mentioned.
Margaret Buckton with the Urban Education Network and the Rural School Advocates of Iowa. The UEM was registered opposed to all of these mandates when they were put into law. So in full compliance with that stance, we are registered in favor of the bill. The Rural School Advocates of Iowa didn't exist yet when several of these were implemented, but they would have been registered opposed. It goes back to the philosophy of who's going to make the decision. And it also allows a laser-like focus of resources. So in those districts and those buildings where there are going to be significant students in poverty that need extra support, our school boards and work with their professional administrators are going to make those best decisions to give that extra support. And the bill does require still, schools have to give information to all parents about resources. So that information will still be communicated. The other thing that's changed since the 2006-2007 when the mandate went into place with school nurses, we now have Medicaid billing, and there's about $100 million on the line that schools will lose if they don't have a certified health professional still signing off on that Medicaid billing. So there's not just the incentive for good student health and all of the data that you all have shared about why nurses are so important to students. There's now a financial dog in the fight for school districts to make sure there is a certified school nurse at every single building doing that. Our school nurses will be more efficient if they're not spending days on reporting of all of these different screenings that schools now are working with. So thank you for bringing the bill forward.
Emily Piper, representing the Iowa Association of School Boards. I noted that there's 13 topic areas, subject areas in this bill. 10 of them are items that our members submitted to us at our request for how could we help give them more local control and local authority. So I guess it would be fair to say that we helped write this bill, and I'm proud of the fact that our members helped write this bill. It's not our intention to get rid of the screening requirements or to put children at risk. It is our intention to try to focus our efforts and energies on things that will, to better focus our attention and our energies. There are a number of provisions in here that are not just related to the record keeping and data collection requirements that are currently on schools with respect to the screening requirements that have been submitted to us consistently, and we appreciate the opportunity to help develop this legislation and are in strong support of moving it forward.
Nothing out of you, Mitch? All right, senators, we have just a couple minutes because you and I have a subcommittee here next. So I'd like to give each of you an opportunity to say anything to wrap up, at which point we can move on to the next subcommittee.
Well, I would just reiterate some of the things that were commented about. I think everybody in this room has the best interest of the child in mind. And I know that school boards are faced with the fact that administration costs have been skyrocketing. One of the reasons they are is because of all these requirements. Some of these do not appear to be necessary or the appropriate role of the school. Most of this, I was told when I first came to the legislature in 1996, the biggest single factor in determining how well a child does in school is the involvement of the parents. One of the things the bill requires is that parents do the stuff that they're supposed to do before those kids can come to school. That seems appropriate to me. And so I think it's a step in the right direction, and I think it's actually going to help the schools and the school boards do their job. So I'm supportive of the bill. I think conceptually it's on the mark.
Senator Crum.
Well, thank you, Madam Chair. I find very little to support in this bill. I acknowledge that it retains the screening requirements, but it guts the enforcement mechanism. I'd call this a Swiss cheese bill, but I grew up in Wisconsin, and I'm not allowed to insult Swiss cheese. Frankly, by forcing parents to deal with the bureaucracy in Des Moines, it increases state power, it increases state function. We haven't had any real discussion here, but I would like to know how many new employees the Department of Public Health would have to employ in order to implement this bill. The fiscal note, I think, would be important. Not only is it more effective and easier for parents to interact with their local school rather than the bureaucracies in Des Moines, but those local schools need that information in order to deliver effective education. They need to know which kids are nearsighted or may have a hearing problem or may have behavioral problems because of lead poisoning or whatever, so that they can make appropriate adjustments to the education that's delivered in the classroom. Some kids may need to sit up front. Some kids may need to be referred for medical treatment, and etc. The schools need that information. The screening work group that was established in legislation last year, I've read through most of their report. I've looked at all of their recommendations. None of those recommendations are reflected in this bill. All of those recommendations indicate other things that can be done more effectively at the state level and disseminated to local school districts. And I support those recommendations in that report. That is not reflected at all in this legislation. As far as school nurses are concerned, we continue to need medical professionals on site in our schools, both to deal with acute situations of a kid getting sick in school and also to help identify chronic situations to make sure that they get appropriate treatment. Librarians, I know all about the internet, I know all about search engines, and what I know is there's a whole lot of junk out there on the internet. We need librarians more than ever to help guide students in their research efforts, in their efforts to learn about the world around them. You can't just go to the World Book Encyclopedia anymore. You've got to have a sophisticated, and kids need to be taught to be sophisticated in their use of information from the internet. So I'm afraid I can't support this bill. Madam Chair, Senator Selsey has also come here. I would hope that we could allow her a minute or so to express herself as well. She didn't get a chance as we went all around.
So I have a couple of senators in here, and I'd be happy to talk with them. We're already over time, so I am happy to talk.
My comments will just take a second, like maybe 30 seconds.
Senator, do you want any comments, or would you like to talk with me after?
I will look at meetings since we're out of time.
Thank you, sir.
Okay, the first day I came to the Senate was my orientation day. My best advice I got that day was from you. When proposing legislation, be sure to do your research about why the current law exists. Why did previous General Assemblies put such measures into place? I can only imagine the hours and years of work and examining best practices that went into the current rules and the hundreds of medical and educational professionals who were consulted. This report, as noted, recommends more funding, not removing requirements. Some kids need adults in their lives to be held accountable for their health and safety. That is just a fact. And if 2.06 is a historic investment in education, then why would we need to unburden schools from requirements simply to save money? That's my comment. Thank you.
Thank you, Senator. I think we had some comment earlier that best says it. Do we trust local school boards, those people who are the parents, grandparents, aunts, uncles, neighbors of the students they're serving, and the administrators who are the experts in the field who are there to help guide and direct with the decisions of the board? Do we trust those people and their teachers to make the decisions that are appropriate to their students, or do we not? It's as simple as that. Nothing in this bill prohibits the hiring of nurses or prohibits the data collection or prohibits the hiring of school librarians. Nothing prohibits it. What it does is allow school boards, school administrators, and teachers who work with these kids day in and day out to make the best decisions that are related to those students. I have signed this bill. Senator Baines signed this bill, and we'll move it to full committee, and I thank you for your time and input today.